Okay. Well, good afternoon, everybody. I am Katherine Johnson with the Richmond Hill Bryan County Chamber of Commerce, and on behalf of our board of directors and the team over at the Development Authority of Bryan County, we are so glad to have you all join us for our 7th annual but first ever virtual Grits in Government virtual series. This year's Grits in Government has looked very different, but we are excited to still be able to present our priorities for our representatives and also just bring really good information to our community from different areas, whether it's a representative or just special guests that we've had during the series. So I will point out that over the next month, our community representatives will finalize our legislative priorities as our representatives go into the 2021 session. Once those priorities are finalized, we will present those 2021 legislative priorities and that agenda to our representatives, both on a state level and the federal level, so that they can understand what we as residents of Bryan County and those that work in Bryan County would like to see for us. So at this time, I would like to introduce our guest for today, Senator Ben Watson, who's currently at his other day job, Dr. Watson. But Senator Watson was elected to State Senate in 2014. He represents District 1, which includes portions of Chatham and Liberty counties and Bryan County. Senator Watson serves as the chairman of the Senate Health and Human Services Committee. Senator Watson also currently practices internal medicine with a specialty in geriatrics. He is a native of Twin City, Georgia, and is a graduate of Emmanuel County Institute and the University of Georgia. He earned his medical degree from the Medical College of Georgia. Senator Watson and his wife, Bernice, a Savannah Chatham County public school teacher, live on Island Hope, and they have 3 sons. At this time, Senator Watson, I would like to turn it over to you to kind of discuss what happened in the 2020 session and what the 2021 session looks like. And for our guests, just so you know, to back up a little bit on those priorities, the priorities that we send to our representatives have to do with transportation, rural health, healthcare and affordable housing, environmental and natural resources, education, and economic growth, just so you have an idea of what we do send over to them. So at this time, Senator Watson, I will turn it over to you.
Great, thank you. Can you hear me okay? Okay, thank you so much. Thank you for having me. This is certainly a new thing for all of us. I know we're all getting used to Zoom conferences, but the elephant in the room is that, we're still in a pandemic and it's COVID, and we're in 2020. I think we're all hoping that 2021 will be better. But listen, we got to adapt, and I think that's what we have done, and we got to learn from this experience. I know that certainly this has been a tremendous learning process for all of us and for me. I just looked at the COVID numbers a minute ago, and I just saw the feed from our coastal area, and the coastal health district is about the equivalent about the state. We're probably a little bit better in Bryan County, Richmond County, and our metro area here, in that we're about where we were at the end of June, right as or before we were peaking in July and August. So our numbers are still pretty dang good from where we are. Now, would we all like them much lower? Absolutely. We would love that, which sort of brings up the next topic of the vaccine. I will tell you personally, I am in one of the COVID vaccine studies. I'm in the Meridia study, which is the same kind of vaccine that Pfizer has been in the news as of Monday morning. It is a messenger RNA type vaccine that produces antibodies. It's a 2-shot, just like Pfizer, and I think most of them will be 2-shot vaccines when they're approved. So I think that I got the vaccine. It's double-blinded, placebo-controlled. 15,000 people got placebo. 15,000 people got the vaccine. Here in Savannah, it was about a 1,200 number that we got. One of the exclusionary questions of the first 5, you have to go through 3 series of those questions, is that do you get out and around? And, you're not a hermit, staying at home, quarantined the whole time. So I practice medicine. I do go to the hospital. We have 1 or 2 patients of COVID patients in the hospital at any one time. So I felt a little achy after my second shot. My back was stiff, my neck was hurt, my arm was sore. about 36 hours. I continued to work. I didn't work out the first night. The second night, I took some Tylenol and ran 3 miles, and my ears have not fallen off. So I think I'm okay, and I think I got the vaccine. So that was about 7 weeks ago. So who knows when it will be approved by the FDA, but I do know that once it is approved, the next day they will be shipped. And if anybody has kept up with this at all, they sound like they are doing a really good job. I know that from my personal perspective, being your state senator, I have been in conversation with the Secretary of Insurance, who is a general in the National Guard. And, our concern is, is Atlanta going to suck out all the dang vaccines because there's 4 to 6 million people there? And are we going to have any in the coastal district? Well, let me assure you that that is a priority, that Atlanta will not be the only place to get the vaccines, and we'll be able to get them. So I'll be happy to answer questions about that, but I just didn't want to let that elephant in the room not be said. So some of the priorities that you have for me that were presented to us, I certainly am in agreement. Like my wife or anybody else, we're not in 100% agreement, but I'll be happy to discuss any of those. From a healthcare perspective, I practice medicine. I'm chair of the Senate Health and Human Services. Last year in 2019, we passed about 40 bills relating to healthcare, including the Medicare waivers, which you may or may not know just got approved by the HHS secretary. So both waivers were approved, and those will be implemented over the next year and a half to 2 years. So we'll get those done, and we'll have many more people covered in the state of Georgia. And really, there's not going to be much excuse for anybody not to have health insurance after we implement this. So I think that's a good thing, and I think that's the right thing. This year we passed, if you include some of the bills in insurance, we passed about 40 pieces of legislation that included transparency, which I passed through the insurance committee, relating to your insurance company being required to post online for you what's the cost, what's the quality. If you measure quality, then you will always have price good control. So good quality means good price. So that's part of the issue that we're dealing with, and I think we need to continue to push on relating to healthcare, but we also need to give a little bit of time, like with the waivers, to some of these legislation to take place. So I would expect continued healthcare legislation, but not as much as we have done. 68 pieces of legislation is a lot over the past 2 years, so I think that's good. Sort of the other elephant in the room is about the election itself. As you heard yesterday, Secretary of State Raffensperger announced a hand recount. So as you know, we spent over $100 million in the state buying voting equipment, and that was spread throughout. The primary was a little rough, but the voting equipment and so forth worked well in the general election. Are there some issues that may need to be addressed? Is there any fraud? I think the hand recount will solve that. Will not solve that, but will delineate that, whether or not there is any significant shenanigans going on, so to speak. So that I think is important, a hand recount, and I think the forensic, the resource limited audit that is going to be done before the certification, I think are both important. The aspects relating to your specific concerns in Bryan County and in Richmond Hill and in Pembroke, I think that I really am on board with virtually 100% of those aspects relating to whether it's rural health care or the environment, education, and the economy. Certainly here in our area, the environment is always an issue, and I think that certainly, my antenna are up when it comes to that. Natural resources that we have here in our area, whether it's fishing or just plain recreation, is ever so important about that. I'll tell you, I would rather hear from some of you and answer some questions rather than hear me talk and go on. So if you would like to help me out with some questions, or if you have any written questions, I'll be happy to answer some of those.
Yeah, so I have 4 questions that we received ahead of time, and then I will let everyone know on the call. If you have any questions, please put them in the chat box, and I will read them out for you. So the first question is, how is working in the legislature changed since the pandemic began, and how do you anticipate that any of those changes, or do you anticipate any of the changes to be permanent as y'all go into session?
I missed the very first part of that. Do you mind repeating that?
How has working in the legislature changed since the pandemic began? And do you anticipate that any of those changes will be permanent?
Yeah, yes, it did change, because you remember in March, it was March 14th that Governor Kemp declared a state of emergency in Georgia. The president declared it March 13th. March 14th, I always remember as Pi Day. That was a Saturday. And also my son got married that day. Fortunately, no one at the wedding or any of the wedding parties got sick, so we felt very blessed from that perspective. So we went back in on that Monday and ratified the state of emergency by Governor Kemp, and he's continued to exercise that and extend it as needed. And yes, we went back in session in May, and we did have precautions relating to that, and there was no doubt about that. And there was a good turnout. We did limit the amount of people in the building, an absolute number. We limited the amount of folks in particular areas. We kept on spacing. The committee that I run, Health and Human Services, we had a large room. We had virtually no audience. We had people from outside come in and so forth. So those things were done. And yes, I think those will continue to happen until X amount of the population is vaccinated and this thing is driven down, hopefully done away with. When will that be? I don't know. I would anticipate that we would be going back in session with those safeguards in place, and we would loosen those as this pandemic lessens. And if the big picture is that some of these things should continue to go on as they have. I mean, we're on a Zoom call. Not necessarily a bad thing. It's good to be in person also, don't get me wrong. But here, when I practice medicine, we do, virtual visits or the telehealth. And I think those are good things. I mean, yes, we do need to see you and draw some blood and check blood pressure and lay hands on you, so to speak. But, at times, a Zoom or a virtual visit is a good thing. So I hope that some positive things come out of this. Wearing masks, I know as much as I don't like to do it, and I'm glad not to be doing it here in my office while I'm talking to you. But there's certain times when a patient is in my exam room and the flu is going around. It's looking back on it, I didn't wear a mask, or the patient didn't wear a mask, and my partner is still complaining about, for the past 3 years, he's gotten influenza A and influenza B every year. So and he's been getting the vaccine. So yeah, we probably should be wearing the mask at times. And we always sort of scoffed at some of the Asians wearing masks, but they were preempted by SARS and MERS, and they maybe recognized something that we didn't recognize. So I think there's some positive things that can come out of this. There's certainly been enough negatives that we can all attest to.
Yes, for sure. We're trying to make the best of it. Okay, so the next question, is there any legislation that was planned during the last session that didn't happen because of COVID that you anticipate will be reintroduced this session?
Yes, the answer to that is yes. There were some pieces of legislation that were just left undone. And I can just think of one off the top of my head. One that I had personally, I was going to have placed, or it passed the Senate, it got hung up in the House, and really more to the pandemic was the question of whether we should continue with daylight savings time or stick it with standard time, or should we? So the ballot question was going to be, do you want to go ahead and change it to standard time all year round? Do you want to change it to daylight savings time when Congress enacts? So Congress would have to make a motion to do that, or do you just want to leave it the way it is now? I'd be interested in seeing what everybody has to say about that in the future. And that I was going to put that, or that was my legislation to do that, to have that on the ballot as a referendum and see what the thought process was. Really to raise awareness. If we all voted to keep it at the standard time year round, I would feel sure that the legislature would enact that the next year. If we wanted to leave it at daylight savings time, and year round, then we would have to wait on Congress. But I think that would get the attention of Congress because sometimes they just don't necessarily get things done in Washington, D.C. That may be something that would stimulate them, maybe not. Or if everybody says, no, we just like the way it is, we want to leave it the way it is. My thought process is that most people want to leave it just one way or the other and make adjustments in the school time in the morning, and at other times, the closing times and things like that. I think that's something we should be doing now that we don't do. And there's some things that I would just want to raise the awareness of this. The fact is that there's an increase in mortality and morbidity, more heart attacks and strokes, more deaths following the 2-week change in the spring. And I think, to me, that is a motivating factor to see less morbidity and mortality relating to the time change in the spring. So that's, I think, that's one piece of legislation that I would like to see it pass the Senate, where we would be waiting on the House.
Yeah, that's very interesting. I'd never heard that about the mortality rate after that. So that is definitely very interesting. Okay, next question. Can you hear me okay?
Yes.
Access to health care, particularly in rural areas, seems to be an issue of growing concern throughout the state. We are fortunate in Bryan County and the Savannah area to have access to quality health care facilities. But as chair of the Health and Human Services Committee, how do you plan to ensure continued access to quality health care in Bryan County and the Savannah area, and to address the issues of access to health care in rural areas? I know that was a lot.
Right. No, that's a really good question. One of the things that Lieutenant Governor Jeff Duncan did, and is actually we served in the House together, and he started that the year after I left and came to the Senate, and he stayed in that House. But the legislation actually got passed after he became lieutenant governor, if I remember correctly. That was 2 years ago. And that's the rural tax credits. So anyone can get a tax credit by designating a rural area or hospital, like example in Tatnall County or Emmanuel County, where I grew up. You could designate a tax credit to go to that hospital where they would use it and for their rural health initiatives. And that's one of the things, and that's, it does require indirect money from the state, because we wouldn't be receiving those taxes, and that money would go directly to that hospital. Now, there are strings attached. There are attached to that. You can't use it to run up the CEO's salary. You have to use it for specific purposes. But that is one issue, and that is something that I think is showing some returns, especially in areas like in Southwest Georgia. But I think to me, the Medicaid waivers is another thing relating to, because if you have people that have insurance and have coverage, especially in rural areas, then I think that you'll be able to do that. We now have the federally health qualified centers. I think there are over 200 in the state of Georgia. I think they're around 260, 270 or so. And those, we just had one, I think, open up. I can't remember whether it was Bullock County or Northern Bryan from that perspective, but there's a new one there. We have a couple here in Chatham County, and those are for people who don't have insurance, and they pay on a sliding scale, and that's supplemented by the federal government from that perspective. So there are several things for that, and I do think we need to continue to work on that. Yes.
Great. Next one that I have, and again, just a reminder, if you think of any questions, you can put them in the chat box. How do you anticipate the state budget may change next year? Are there any changes, if any, reflective of necessity due to the pandemic, or are they reflective of changing state priorities? I would assume both, but.
Yeah, that's a great question. Again, I probably should have addressed that already, in that, we're supposed to be there 40 days or less, and we're supposed to balance the budget and get out of there. So the budget being balanced is something that we got to do by this in the Constitution. It's not an amendment. It's there. And we're one of the few states, during the downturn in the economy that kept our AAA bond rating, which when we do borrow money, which is capped, by the Constitution, but when we do borrow money to do projects, then we have the lowest interest rate, and that's important to retain. And we've continued to retain that AAA bond rating. The fact is that there was a tremendous reduction in tax revenue, as you would imagine, with the shutdown of the economy. The good news is though, and obviously the employment rate went sky high. The good news is that Georgia has weathered it in the top 5 states in the United States. So our numbers are much better. Our unemployment rate is only 2% above the 4% that was bad. It's like we're like at 5.8 or 6% now, somewhere in that area. That we're much better than the rest of the United States. We're doing really well from that standpoint. Our revenues also have portrayed that. Now, are they what they would have been, last year or year before? No, they're still there. And we probably will have to do some budget tightening, but I don't see, and even Blake Tillery, who actually represents part of Liberty County, a small portion that I don't have, but Blake Tillery, who is the chair of the budget process in the Senate, he's a state senator, with me just above us here, just north of us in Vidalia. But he said a couple of days ago in a text that we were answering a constituent together that he did not anticipate any reduction, from that standpoint. So, we started off looking at a 14% reduction, then it was down to a 12% reduction. I think we ended up right around 10% reduction in the budget. Of course, we always prioritize education. That is our number one priority. That's our largest piece of the budget. They are cut last and they're cut least. And when we in the downturn in the economy, what did we add back first? It was education. So you got to remember that's about 53% of the budget. That's K through 12 and higher education. But that's a huge portion of our budget, and that is our first priority in adding back. And that's our last one that we do cut when it comes to the state budget.
Thank you. Yes, we are very fortunate to live in a state that has, considering everything going on, has done pretty well. And again, number one for business and so much more. So we want to thank you all for your continued hard work of making sure it's a good place to open and have a small business in general. One question that I have from the chat box, going back to the election, how much, if you know, is it estimated to cost to do the hand recount for Georgia?
Yeah, I mean, that's a good Democratic talking point. I get that. And it's a legitimate talking point. Secretary of State Raffensperger took that into consideration in that we moved he did by emergency order because we're in a pandemic. He was able to move the runoff. So we have a state runoff, which is Public Service Commission. I think it's December 8th. And then there's a federal senatorial runoff on January 5th, somewhere in that area. So he moved that election December 8th to January 5th. So the state and counties, mainly the counties, would have to be paying for 2 elections here. One race, Public Service Commission runoff on December 8th, and then another one here in January. So he did away with one December 8th, and he combined those 2. So from the budget process, that we should come out ahead from that standpoint. The state would, and so would the counties. So I think that's a positive, and I think, listen, I get it. There's pushback on both sides, relating to the election, and these are all trying times for us. There's no doubt about that. But we all want to make sure that this is, it's a fair, equitable race. It's legally done, and someone's illegal vote doesn't cancel out my legal vote. So, I mean, I think it's a fair thing to do, and I think it's the right thing to do, and I hope that will put it to rest. Listen, if we find issues and we need to address it, then I think we will, we'll address that next year in the legislative session. So, I think that's important to do. The number one, I'm gonna switch gears on this a little bit. We were talking about the economy and the pandemic. In Georgia, we had a surge in July and August that, I think that we learned from, because if you look at the numbers now, we're back to, we're flattening out and we're way down on the curve. But having said that, our economy has fared pretty dang well, and our unemployment rate is down. So nobody's back to normal yet, and when that will be, I don't know. But that's part of why I started off the conversation about the vaccine. and trying to give us a little bit of hope. Pfizer's announcement on Monday was huge, but it means that it's working. And I think the antibodies that we have drawn and some of the aspects relating to what they call neutralizing antibodies, I think will be there, and I think it will be productive. So I hope the FDA and Pfizer and Moderna, they'll be in conversation ahead of time. It's not like everybody's in a silo. We just dump it all on the FDA. So the FDA will be working in conjunction. So, and when the FDA says we're good, then the next day, vaccines start getting shipped. So I think that's great.
It's amazing how fast that they've been able to do that, considering how long it normally takes. So, well, I don't have any other questions, so I'm going to give it just a second if y'all want to type in a last minute question for Senator Watson. And as we do that, let's see. I don't see any other questions, so I'm going to close that option. But I want to, first of all, sincerely thank you, Senator Watson, for joining us today and working with us as we try out this new virtual option for our Grits in Government legislative series. We want to thank you for all the hard work that you've done for our community and continue to do as we go into a new year and new session. I also want to thank everybody for joining us today. We are recording this session, so if you weren't able to watch the whole thing, or if you want to go back and rewatch or share this with your friends, we will have it up on YouTube later on this afternoon, and we'll be posting it on our Facebook page. We are so fortunate to have the leaders that we do for Richmond Hill and Bryan County, and I hope you leave this call knowing a little bit more about the efforts that are being made to continue to lead and strengthen this community going into 2021. Before I go, I do want to remind you of our next call. It will be Tuesday, November 17th at 10 o'clock a.m. And we'll be hearing from the Georgia Chamber of Commerce CEO, Chris Clark, and getting an update from a state level of kind of their outlook for the new year and kind of what they're working on with legislators as well. So I thank you again, Senator Watson, for joining us, and thank you everyone else. I hope y'all have a great afternoon.
Great. Thank you. Bye-bye.